Welcome, beloved students, in the third lecture of Chapter 2, Inflammation. We are going to start a topic called Emperipolesis. What is meant by Emperipolesis? Emperipolesis means active penetration of one cell into another cell without changing morphology or physiology. Active penetration of one cell into another and exit without changing morphology or physiology. Let's suppose this is a cell. Next cell from here, it enters to this cell and then leave this cell, and the physiology and morphology of this cell is not changed. There was a normal cell, one cell come inside the cell, then goes out, what means exit this cell, but the morphology and physiology of this cell is not changed. It is called emperipolesis. And if I give you examples of the emperipolesis, so the megakaryocytic emperipolesis example is in myelodysplastic syndrome, not CML, this is CLL, okay? Chronic lymphoid leukemia we have covered in the leukemia chapter. The next one is neutrophilic extracellular trap. The next topic is neutrophilic extracellular trap. For example, there is exposure to microbial antigen to neutrophil. Means microbial antigen exposure to neutrophil. Neutrophil will secrete a molecule called interleukin-8 or lipopolysaccharide. This interleukin-8 will further activate neutrophil. This interleukin-8 or lipopolysaccharide is secreted from microbial antigen, not from neutrophil, sorry. Now, this interleukin-8 will activate neutrophil. Inside the neutrophil, there is lysosome, and in lysosome, lysosomal granules are present, and lysosomal enzymes are present. And lysosomal granules, a favorite enzyme is NADPH oxidase, respiratory bus oxidase, and the second one is PAD4, protein arginine deaminase. And the molecules are myeloperoxidase and lactoferrin. This NADPH oxidase and PAD4 means protein arginine deaminase. When there is the rupture of the lysosomal granule, it will release myeloperoxidase, lactoferrin in lysozyme, while this NADPH oxidase and PAD4, it performs citrullinization of the histone present in the DNA. These two enzymes produced an action on histone called citrullinization of histones, and due to this histone citrullinization, there is decondensation of the chromatin, and histone decondensation of chromatin, and there is the degradation of this chromatin, so we can see histone degradation product. In these histone degradation product, they can stick to antigen. So in this way, microbial antigen is destroyed. For example, if I give you an example to you, let me give you an example. this is neutrophil. Inside chromatin condense, chromatin will degrade. Now this chromatin will going outward because the cell is injured. You can see this is a cell. Inside the cell granules etc are present. For example, there is a chromatin. When this chromatin degraded, it will going outwards. When it going outwards, it will attaches to the microbial antigen. What will attach? The histone degradation product or the lactoferrin or lysozyme. It will attach to the microbial antigen. So simply neutrophilic extracellular trap purpose is antimicrobial, means protective. The second one is when nuclear chromatin will going outwards. For example, this is a cell, this is a cell, and when nuclear chromatin will going outwards from this cell, there will be formation of anti-nuclear antibodies, and that would lead to autoimmunity. And the third function of the neutrophilic extracellular trap is deep vein thrombosis. So neutrophilic extracellular trap is also known as beneficial suicide. Beneficial suicide.